pharmacist.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Very good.
You can make my
This is Rogers TV.
Hello and welcome to this special edition COVID-19 program on Rogers TV dedicated to how our community is responding to this pandemic. My name is Carol Merton, and for those of you who've been watching the program, you know that I like to spend just a few minutes at the very beginning to say thank you. Today I'm going to be changing my thank you message slightly, so bear with me as I read it through because I have not memorized it. So today I want to read excerpts from a letter that I actually received this morning from a writer, Allison Wines, who sent, this letter was actually sent to me by Francesca Dobbin, who is the Executive Director of United Way, Bruce Gray. So these are the excerpts that I want to share with you today. There is an invisible group of people who aren't being recognized, who are working intensely to keep the world turning, to make sure that those on the front lines have the support that they need, and those at home have something to go back to when we get back to the other side of this. Who are you? You're the HR teams working 80-hour weeks to start workforce planning from scratch, redeploying team members, trying to think of something, anything, to preserve jobs. You are the CEOs of charities, writing new budgets so you can keep the world and help the world with funding that has evaporated overnight. You're accountants and bankers, restructuring finances and debt to help small businesses stay afloat. Your trade managers negotiating frantically to get hand sanitizers and face masks into the country. Your consultants supporting clients through massive change, unsure if you'll get paid for your work when it's all over, but doing it anyway because it matters. Your hospital administrators running payroll for the nurse that just clocked 30 hours of overtime. Your communicators trying to find the words to explain a crisis the likes of which have never been seen to your organization's staff and the community. You are not invisible. Our message back to you is this: your contributions are greatly appreciated. We send to you a most heartfelt and sincere thank you for what you are doing. And on that note, in advance, I'm going to thank our two guests who are joining us today. So I want to introduce you to Kristen Watt, who is the pharmacist and owner of Kristen's Pharmacy. You tell me if I don't get this right, Kristen.
Got it right.
Good. And Ian Reich, who is the public health manager, oral health and harm reduction at the Grey Bruce Health Unit. How'd I do?
You did perfect.
Thank you both for joining me today. And one of the topics that I would certainly appreciate you discussing today, and any others that you want to share with us, is the whole area of substance abuse and needle exchange and stress management in these times, certainly that we're going through right now. So I'm going to pass the program over to you. I may ask you a question, but mostly I'm going to just let you guys chat, and I'm going to listen and learn. So thank you very much for being on the program today. Who wants to go first?
Ian, I'm going to let you go first.
All right. Thank you so much. So, Carol, you're absolutely right. My portfolio does include harm reduction. Obviously, now in a state of emergency, responding to a public health emergency, all workers here at the health unit are wearing multiple hats. But my portfolio around harm reduction specifically does look at people that do use drugs. And to connect the dots, we have lots of great messaging about how to prevent transmission of COVID. But at the same point in time, many people that use drugs, it's not realistic for them to practice all of those messages. They have to go out to get their supply. They have to go out sometimes on a daily basis to get some medication or even alcohol for that matter. They have to worry day in and day out about what happens if they don't get their supply and the withdrawals that they may experience. So I have to say that now is a absolutely wonderful time to have that discussion about having a safe supply available for all people that do use drugs. The province has dedicated to keep alcohol stores open and cannabis stores open, which is a wonderful initiative. I think it's a must. People that do struggle with substance abuse related to alcohol, they're one of the only groups that are potentially at risk of dying if they don't have their drug. Withdrawal symptoms from alcohol can be fatal. So these are all really important times for us to identify what changes can we make for the future. We identify them now in an emergency situation, and what can we do in the future? So from my stance, I think now is also some of the most important times to make sure that people that do use drugs have access to clean supplies of drug use equipment. So we are dedicated here at the health unit anyway to ensure that that program, our needle exchange program, always stays open, regardless of what level of response we're at responding to COVID. We understand that this is a hugely important initiative to keep going. So we offer our clients safe smoking kits. Obviously, we don't want people sharing crack pipes or meth pipes together. That's a perfect area that COVID can be spread, as well as safe injection supplies and safe needle supplies. But also one of the most important things is people are still struggling with overdoses during this time as well. So we are making sure that we are dispensing naloxone, which is that life-saving drug that can reverse opioid overdoses as aggressively as we always have been, regardless of what we're doing in response to COVID. Those are two major areas that we want to ensure keep going. And a third is communicating with all of our system partners. So our opioid working group that we do have going here in Grey Bruce, we touch base regularly and make sure that all information is shared as it's relevant to the various sectors. So those are some very important things that we've highlighted from the beginning of this COVID situation. And I think a really innovative change that I've heard of, I don't have all the details, and maybe Kristen, this is where you could potentially jump in, is the increased responsibility and role that pharmacists are playing because of the lack of face-to-face primary care availability within the primary care section. I don't know if that's something you're able to speak to, Kristen.
Sure. So at this time, it can be difficult to get in to see a primary care provider, and that could be a nurse practitioner, that could be physician, that could be an addiction counselor, etc. So it's been more difficult for clients to get in to see these providers. Pharmacists have always been and are still a frontline health professional. We're actually one of the most accessible, and we've always prided ourselves on that. And suddenly with COVID, now we're the most accessible. So what we've done, and I can only speak to my store, but what we've done is created, unfortunately, a barrier to entry to the store, but we've really stepped up our game in terms of telephone consults, video consults, and delivery. So all of the services that we could offer previously and can now offer, which I'll get to, can still be offered, and we just do them in a bit of a different way. During COVID, we did receive some additional prescribing powers. Prior to COVID, we were not able to extend or change prescriptions for opioids, narcotics, methadone, Suboxone, and things like that. At this time, if a client runs into trouble in terms of getting access to their prescription, it's something that we can explore with them, how we can ensure that they continue to receive their medication. I do have to say, I work really closely with a number of prescribers in the area, and we've yet to run into that problem. But I do encourage anybody who is worried about their access to their methadone, their Suboxone, or their opioids that they're using for chronic pain that they would go through withdrawal without, that they reach out to their pharmacist, because they often have ways that it can be managed. And if they aren't met, if their needs aren't met, then feel free to reach out to us, because we do have that good relationship out there. We also, prior to COVID, had the ability to extend all prescriptions with the exception of narcotics. Now we can do the narcotics. So nobody should be going without anything, because a number of our clients who receive treatment for addiction or aren't yet receiving treatment for addiction are getting other medications that they need, antidepressant medications, blood pressure medications. We have to treat the whole patient. So make sure that you're still getting those medications that you need. That's really, really important. We are still providing the needle exchange that Ian talked about right through our door. So clients come up, ask for what they need, they receive it, and off they go through our little safe window. So it keeps them safe and keeps us safe. We're not accepting returns of needles at this time, just because nobody wants to do a full exchange through the window. So we give them disposals kits and say, hang on to this. When this is over, I'll take back everything that you have. And everybody's been really grateful and appreciative of that, and we continue to do that. And then naloxone, that's a big one. We're going through a lot. We're dispensing a lot. We want to keep as many people safe as we can. One thing that we've said a lot through our harm reduction programs is don't use alone. And with COVID, we're saying stay home, stay home. And the people in your home may or may not know about your drug use. And I'm not saying that this is the time to tell people. I'm saying this is the time to make sure that you're not using alone. And that's really, really important. So in some instances, it may be safer to be around people because your risk for overdose is less. You have people around you. So have a naloxone kit. And I'm still going to go with don't use alone. This might be time to have conversations. I have had people who have decided to enter treatment, and I have had people who this is not the time. This is a really, really stressful time for people, a really stressful time. Jobs, the economy, having to stay home, especially if you have young children or you're a caregiver for somebody. So you have to know where you're at and embrace it at this time. I see a lot of positive mantras out there, starting a new hobby and things like that. This is not the time for everybody to be getting into things like that. We need to understand that everybody is going through a big trauma. And everybody's going to deal with that trauma differently. And I think it's really important for all the frontline workers, the pharmacists, the doctors, the nurses, the people in the public health. We all acknowledge that this is a really traumatic time and stressful time for a number of people. It is our goal now, and it always will be, to treat you wherever you're at. No judgment. Absolutely none.
And I think you raise some excellent points. I mean, I want to go back to Ian's comment too about that people can die from withdrawal, and I'd like a clear statement from you. This is not the time to judge people for their addiction and their substance use. This is not the time to say, well, good, they have to stay home, they'll stop their habit. Can you speak a little bit about the judgment and then the real risk to these people because of withdrawal? Would you mind addressing that? Either of you, doesn't matter.
I mean, I can definitely speak to the ongoing stigma that is definitely associated with various types of drug use. And what's actually a little ironic is that alcohol, at this point of time, if not available, would probably be the most dangerous substance to withhold from the general public. So I do think that at this point in time, stigma has to disappear. We can't have it. We're all in this 100% together. And those that maybe have not as much benefit that we do of being able to stay at home or being able to stay with just our family and are forced to live in large group settings, sometimes living 10 in a one-bedroom apartment, the message of be alone, as Kristen mentioned, is sometimes more risky than that of staying within a community to ensure immediate safety when using drugs. So if we look at it in context of opiate use per se, if at this point in time, if someone were to struggle and not be aware of changes in prescribing ability for their opiate, they may turn to the streets. And
Yes.
as a result, they're now at risk of overdose, of using street drugs that they're not used to. They'll be using alone, they won't have naloxone on hand, and they won't necessarily understand all those harm reduction techniques that we try to really embed in the entire population about why we do it. We're doing this to save people's lives in hope that they will have a chance at some help tomorrow. And accessing that help right now is even harder than ever because so many services are shut down to the absolute bare minimums. So where you used to be able to walk into a place to get some counseling may not be available right now. So as positive and as sympathetic and empathetic as we can be as a society, now is the time to be that way and not judge people that are using drugs, whether it be alcohol, whether it be cannabis or opiates. They all have a variety of risks associated with ending their use rapidly or all of a sudden. So we want to make sure that people understand it's okay to talk about your drug use. And as the people that receive that message, the general public, we should not make people feel bad in any way, shape, or form because of what they choose to use. Alcohol is, again, the most common drug of choice. And in this point of time, if the LCBO stores were to close, I could see that being the most significant risk to the public in terms of immediate withdrawals from drugs.
And it's important to recognize that sometimes alcohol is perceived as a social drink rather than an addictive drink. But it would be interesting to see if the sales are up at the LCBO, and that's not a question. It would be interesting. Kristen, I know that as a pharmacist, pharmacists have always been the go-to people for information about medication, drug use, just a tremendously valuable resource. We have a lot of people in our community in chronic pain. I think that was just mentioned a bit earlier in this program. Are you finding that people are having challenges around that and accessing your services around chronic pain management, which can often lead to, the use of stronger medications?
So I have noticed that as people have had time to pay attention to themselves, they might be more in tune to some of their pain symptoms and syndromes. We've actually had some really great news stories where clients have reached out. And because physicians are able to do telemedicine consults, and they continue to do so, I've had a client who reached out to me about her poorly controlled pain. I reached out to her family physician after our consult, family physician in another city. Family physician reached back to the client. They had an interaction. We started new medication and she's doing really well and she's pain free. So now's actually a really good time if this is something somebody would like to address. Call the pharmacy and have that consultation. We have the ability to have telemedicine consultations with our clients that are covered by the government, and then we can refer them to their family physician or request those prescriptions. So I think that we're not seeing chronic pain any more poorly controlled at this time, but there's a real opportunity to get a handle on it because we can use those telemedicine avenues, and it stops people from moving around, and then it helps the people who couldn't move around before. So if you couldn't get to your family doctor that was out of town, if you couldn't get to the pharmacy that you wanted to chat with, now those things being covered, pick up the phone. We can make that call. We can do that conversation. I do have clients who don't have a phone, but they do have access on occasion to the internet. So they text us or they FaceTime us when they can, or they send us Facebook messages. And we're offering services in all the mediums that are out there to meet people again where they're at and be able to address those needs. I think this is a really good time to address those questions and those concerns.
Who would think in the middle of a COVID-19 pandemic, there's a little silver lining to a very big dark cloud when and we need to look for those stories for sure. Ian, you had mentioned that not only that the health unit has safe needle exchange, and I know Kristen had talked about a safe window. How does the health unit handle the needle exchange? And then you also talked about safe smoking supplies, which maybe you can elaborate a bit about that.
Definitely. So for our needle exchange program, we've definitely varied it a little bit to manage the risk associated with meeting people face to face. So we do have active screening for all clients if they do come into the building, and we've relocated where we do the exchange so it becomes an absolutely no touch scenario. And we can always keep our distance, and PPE, our personal protective equipment like masks and whatnot, are always available for clients when they come in, but also for all of our staff to make sure that they are safe. We're not handling any returned sharps at this time. What we do, we have a large bin outside that we direct people to place all of their used returned sharps in so that we don't have to handle them at this point in time. What we do is that bin can be emptied by a provider that we have a contract with so that we don't have to touch any of those sharps containers for risk of cross-contamination. And I think, sorry, your last, safe smoking kits. So it's not smoking as tobacco, it's smoking as in crack and cocaine or crack, methamphetamines as well. And what they are, they're simple glass pipes. I'll try and bring it up to the camera, that are used. This here is a meth pipe.
Yep.
If you can see it closely. The reason we want to make sure that these are always available to the public is we don't want people sharing these. If you share them, you're sharing your germs. And if someone does have COVID-19, whether being aware of or not, if a group of people were to share this, obviously transmission would be highly likely. So we want to prevent the transmission of COVID as much as possible. And our safe crack pipe looks exactly the same as this, except without that little ball on the end. So the premise is the same. We want to make sure that people practice not sharing drug use equipment of any sorts, especially in this point in time.
So certainly what you're describing, and people may have a challenge, with wrapping their head around this, but by providing these supplies, you are actually assisting the community to stay safe. That it actually protects everyone because you're ensuring that the risk of COVID-19 spread is minimized by the sharing of these types of pipes, correct?
100%. And these were actually common practices that we had in place prior to COVID-19 as well. So with use of crack or methamphetamines, when you smoke them, obviously the heat is pretty extreme on the lips. And what we see is very common to people that do use this type of drug. The lips crack and bleed very regularly. So the risk of transmitting things like hepatitis C are actually fairly common. So if we can prevent 1 or 2 cases of hepatitis C or 1 or 2 cases of COVID-19, we've saved the healthcare system enough money to fund our needle exchange program for a whole year. So any of those preventive measures are not only cost effective, they're also a way, every time a client comes in that does use drugs and gets one of these kits, it's a new interaction with the healthcare system. It's a new degree of trust that's gained every single time those interactions happen. And as trust is gained, we can start having those conversations about seeking help, about providing counseling, and about, perhaps decreasing use and ending use. The ultimate goal of harm reduction, which is a full spectrum from using daily to not use to abstinence, we try and find and meet people where they're at and slowly shift them across that spectrum to not using. It's not always the end goal. Sometimes the person just has to use a little bit less, and that is fine. Every little bit that we can decrease is better for that person's health overall. And the more they can practice safe techniques, the less illness that they'll be at risk of getting to. So all in all, it's cost effective, and it works to be sympathetic and empathetic and successful in getting people moved along that spectrum.
So keeping the door open. The phrase that both of you have used is you're meeting people where they are at. And I think that's a significant phrase. Naloxone kits. Two questions. Where does the funding come from? Kristen, you mentioned you hand out naloxone. I know the health unit does. And second of all, paramedics and the use of naloxone, they're certainly at risk with COVID-19 when they're close to people's faces, and maybe you could comment a bit. So, Kristen, where do you get your funding for the naloxone kits?
Sure. So each kit is individually funded by the Ontario government. We bill direct through a client's health card, and if they have no health card or prefer not to provide one, we have a way to bill without a health card. So we can bill through an anonymous profile. So they're completely funded. They're $0, and we give them out en masse. And sorry, your second question about EMS and being up close with people. So these are nasal sprays, and they go up the nose and are sprayed. The client does not have to breathe in. It won't generate expulsion of the droplets that contain COVID. What it does is it simply reverses the effects of the opioid overdose, and the client will awake. So it's sprayed in the nostril, and the client doesn't have to sniff. Often they are unconscious or losing consciousness. They're not breathing as quickly. They aren't breathing this in. It's being absorbed in the nose. If they don't awake within 1 to 2 minutes, we do another spray on the other side. And we continue to do that until they awake, or EMS does come, or they're transferred to a hospital. We remind people that they should be transferred to a hospital after it is used, because the effects of naloxone wear off, and often more quickly than the opioids. So the overdose can again. So it's like an EpiPen. We use it to rescue a person, but they continue to need treatment in that time. So we encourage anybody who ever needs this to still call 911, seek that treatment, and know that you are protected by the Good Samaritan law for the drugs that may be around at that time and in that moment, that you're protected enough to call for help, and charges won't be laid for what's happening in that moment. So it's really important to be aware. And this is why we really want people to not be alone and not use alone. I presume EMS will have personal protective equipment for administering naloxone, transferring patients, and things like that. And that's why it's really important that we continue to pressure our local and federal governments to continue to procure these items, and that we reserve these items for our medical professionals. This is why we are not selling medical masks or N95 masks in our store, because any of the ones that we get, we immediately transfer over to the healthcare professionals. And we get asked for them a lot, and we want to ensure that the professionals who might actually be exposed due to droplets and things like that have access to them. So in that vein, you won't be finding or be able to really get medical masks and N95 masks in stores as well. And that's just to keep everybody safe.
Excellent. So I can't believe our time is almost up. We've got a minute left in the program. Is there any last words that you'd like to share before we sign off?
I would, if it's okay, and I would like to remind people to reach out to their pharmacy, ensure that they understand the medication that they're receiving, if they're receiving a safe supply or daily doses of anything, because as things become in short supply, pharmacists may have to change the doses or change the brands that you're getting. So always ask, have that relationship with your pharmacist, call, make sure you know what you're getting and where you're getting it from. Out in the community, I'm really glad that the liquor stores and the beer stores are staying open, because we need to understand that manufacturing our own products or getting in things off the street can be a really dangerous idea. It can cause a lot of harm. So continue to get your supply, whatever it may be, from reputable sources.
I want to thank you both very much. This has been amazing and very informative. Please take care and stay safe. And thank you to our viewing audience for joining us today. Please join us again to learn more about community responses to COVID-19 and the pandemic. Take care.